Hello, everyone. My name is Bethany, and I'm the CEO of Bethany Consulting and the co host of the Managing Dental Drama podcast. I'm super excited to be here today talking about something that I believe is foundational to every patient interaction in a dental practice, and that's the art of creating a personalized experience. Now, I work with a lot of offices all over the United States, and what I find is teams are so eager to create a positive experience, but they also realize just how difficult that is. So, I'm going to talk about a few foundational principles today that I believe make all the difference in the world. Now, number one is preparation. So, I have found that this is the area that we tend to lack in most dental offices. No, we're prepared with the right instruments, the room is clean, the waiting room is set up and ready to go, but we haven't truly fully, as a team, prepared for that patient appointment. So, I like the chart audit program or chart prep program. What that means is the day before, we either have a designated person on the team or each person can be responsible for a certain set of patients. Within that chart prep process, we are looking through all the nitty gritty details of this patient's history and also what they're coming in for today. So, I'll give you a scenario of how this might play out in a particular practice. So, let's say we have a team with a hygienist and she has her own set of patients. We've got the dentist and the dental assistant that are seeing their own set of patients. And then we have the business team that is interfacing with the patients both on check in and on checkout. So, what a chart prep process might look like is the hygienist goes through and does her own preparation. She's looking for things like medical history. Are they due for a medical history update? When was their last appointment with us? Was there anything substantial that was discussed at that particular appointment? Do they have pending treatment? Are there things that they've talked about before and we haven't done yet? Why or why not? She may be looking at her last perio chart. What did the measurements look like? Do we need to do a full perio chart today or are we just doing a spot probe today? So she's looking at it from a clinical standpoint, not just hygiene, but also medical history. She's flagging for herself certain things like, I wonder if this patient is still taking the same medication. 6 months ago, when they filled out this medical history, they were. They're not due for an annual medical history update, but I need to ask Sally about this particular medication. So they are focusing on it from a clinical standpoint. The doctor and his assistant, usually the assistant is the one doing the chart preparation process. They're looking at all the same things. Medical history, how was blood pressure the last time that we did treatment on this patient? Are they due for a medical history? Do we have a consent form ready for the procedure that they're scheduled for today? Did the patient have any questions or concerns the last time when they were with the hygienist that they talked about the procedure today? Do I need to be prepared for those same questions today? We're also looking at things like medications and how that might interfere or assist in today's appointment. So they're going through and doing a similar clinical chart prep, but it's got some nuances to it that are specific to treatment. Now, the business team has a very important role here. While they're not necessarily as concerned about the clinical side of things, although they may be the ones to hand out a medical history form, or they may be the ones to actually ask the patient a question, hey, are you still seeing Dr. Jones for your thyroid issues? They may have a few follow-up questions that they're asking at the patient check-in process, but for the most part, the business team isn't interfering with the clinical or medical side of things. So, what the business team can prepare for is the personal side of things. So, they can go on their own little hunt to look for little personal clues that we have kept. So, they may look back at the hygienist's last notes and realize that Sally was going on an Italian cruise. And so, they are making a note on Sally's chart or on their little schedule that they're keeping about the Italian cruise. Or they may go back and see that last time Sally really struggled to get here for her appointment due to sickness. So they may be following up with Sally and go, hey, how's your health been? I know you've really been struggling with a lot of different sicknesses. They're going through and looking for personal comfort measures. So Sally is always cold when she's in the practice. And so there are certain things that we can have prepared for Sally before she comes in because we know that she always comes in cold. So that may mean that we have a nice little warm cloth ready for Sally when she comes in, if we want to go above and beyond. It may mean that we have a nice clean blanket for her that we've got rolled up and has a little bow wrapped around it. We're like, hey, Sally, welcome to your appointment today. We can't wait to take care of you. Hey, I know that you stay cold in our office, so I've got a little blanket prepared for you today. Little things like that are where the wow factor comes in. So, from a clinical chart prep standpoint, it's pivotal that we are prepared for this patient. That's the most important preparation that we can do. But from a personalization standpoint, that's where we really add the wow factor. So I want to play out a little scenario here. What if we did one without the other? So let's say that we're perfectly clinically prepared for this patient. We've got all the materials we need. We know what Sally prefers in the chair. We're clear on what she's coming in for. We know she's due for medical history or not due. So that's all smooth. But what if we don't have the personalization component? Then it is just a regular everyday appointment. And Sally doesn't even know the amount of preparation that's gone into her appointment. She's completely unaware because it feels like a normal appointment to her. Now, let's flip the scales and say that Sally comes in and our business team has done a phenomenal job of finding ways to personalize her appointment. So she has this amazing wow experience when she comes in. There's a blanket waiting for her. They asked about her Italian cruise. She's like, this place is amazing. And then she gets back to the back, and clinically, they're not prepared for her. They don't know why she's here today. They're asking questions like, okay, Sally, I see that we talked with you about the crown on your upper left side. Is that what we're planning to do today? And Sally's going, wait a second. Don't you know what needs to be done today? We forget to take the blood pressure, or we take blood pressure and we're surprised that Sally's blood pressure is a little bit high. And we're like, Sally, your blood pressure's high. And she's like, yeah, it's high every time. Did you not look back at old records to see that we've talked about this before? So even though we have a wow experience on the front end, once she gets in the chair, we can look disheveled, and that is not going to bode well for us. If both of these are done simultaneously, meaning the business team has personalized the appointment and the clinical team is fully prepared for that appointment, then when she checks in, she gets that personalized experience. She's like, wow. Then she gets back into the back and the clinical team is fully prepared for her. That appointment is smooth, but she sees it. She knows that they've been prepared for that appointment. It does not feel like a regular everyday appointment. It feels like an amazing experience. So I will say that good customer service, good patient experiences, the full team is involved in being prepared for that and for personalizing the appointment. And when we personalize it, when we take it to that next level, then all of the effort clinically that has gone into preparing for Sally's appointment is truly fully noticed and appreciated. So go out there and personalize those appointments.